Hi, I'm Dr. Stacy Benson. I'm a family physician and owner of Paradigm Family Health. We're a direct primary care practice here in Dallas. A frequent question we get is, why would I pay for your monthly membership model if I already pay for health insurance? It's a very fair question by all means, and it's actually a common misconception that we have, not just from patients, but other providers alike. So the majority of our patients actually carry some form of health insurance. They don't use it on a regular basis, the same way that you don't use your car insurance when you need to put gas in your car, change your oil, or even get into a minor fender bender, right? Because if you did, what would happen? It will raise your premium. The same is true for health insurance. We just don't access and use our health insurance the way any other insurance industry is built. And it has changed over the last few decades for how health insurance and our health industry has worked together. So health insurance is just that. It is insurance. It is not care. So why would you pay for our care model when you already pay for health insurance? Because you haven't paid for care, right? And so while health insurance does allow for some negotiated payments where you're paying a small amount whenever you go, it's called your copay, whenever you go to another provider's office, it still isn't necessarily 100% covering said care. And then on top of that, is that care the care that you need? For many patients, the answer is yes, which is great. It needs to be there as a system by all means. But for a lot of patients, the answer is no, it's not the care that I need. I want to make sure that my doctor knows who I am, that I'm not just this person they see once a year. They need to know who I am when they call when there's a problem. They need to trust in me and have a relationship with me. They need to be able to talk about not just what my labs look like, but what, the social factors that go into our health too. They need to be able to spend more time with me than just a 5-minute visit. Our visits on average are 45 minutes with the provider. That's not waiting in the waiting room. That's with me in the room with you. And they often want to make sure they have somebody that can bring in any specialty care that they need or get rid of specialty care that's not needed, that you were instead, to be frank, farmed out to because they didn't have time, which happens. I hate to say it, but it does. Those are all fabulous benefits of joining our practice. And we can always go through every person as they're thinking about joining and their individual needs and how we can fit best with them and how they fit into our model versus into a traditional health insurance industry-based model. But you won't know until you come experience it. So feel free. Come sign up for a free meet and greet. We do them virtually and we do them here in the office, right here in this room.